number of times when people are deferred. So you might not get listed right away. You might have a few other things you have to do. Or you might be declined, because usually we catch that beforehand. Usually we'll have a good idea you're going to be declined and then get you to another center. I've had as many people get transplanted at another center as I have at UVA. And Leah is one of those cases. She was listed for a long time. She started to turn the corner, and we quickly split, got her down to 2. So it doesn't matter where you get it. You need to make sure that they're going to help you get to the next place that's bigger. You need that. Okay? Anyway,
Can I just ask one question?
Yeah.
If you're listed with you're an organization. Why do you need to go to multiple ones?
We don't.
Like one?
Well, no, it's a good question, and I will address it in just a second because I'm coming up. I've got a map on here, and I'll explain it. But it's a good question. Oh, it's coming up. So there's lots of people waiting for all different kinds of transplants. At UVA, we have all of the transplant hearts, lungs, kidneys, livers, pancreas. We do all kinds. We just had our bone marrow, stem cell, all kinds of transplants. We do all of them. And here's the waiting game. This is the hard thing, is getting somebody on your list and waiting with them while they're waiting for a donor. So you ask why. So here we are, we're Charlottesville, right there. Here's Northern Virginia. All over the nation, they're marked out in regions. And so, and they're called your organ procurement organization is who works with your center. So LifeNet, who's based down in Virginia Beach, they look for organs for everybody waiting, for heart transplants, for lungs, for kidneys, for all the different centers that do transplants. And so some people will choose to be listed in the region they live, or if their center, like Northern Virginia, is actually in a different region, so they have a different OPO. And so what happens is when there's an organ, an offer for an organ, or a donor organ, it goes to your area first. People waiting for a lung or a heart or a kidney, it goes there first. And then if there's nobody who's eligible, then it goes out. So then it would go out, and the offer will go out to NOVA, to UNC, and then it goes to a bigger. We'll fly 2,000 miles to go get a lung if there's nobody in between that has matched that offer.
If I had a moment, I'd probably figure it out, but what's an OPO?
Organ Procurement Organization.
Oh, okay.
That's LifeNet. And then they've got like...
So do you have a better chance of getting an organ if you go for a centre in your state?
Well, yeah, I think that depends.
Okay.
Yes, I'm going to say yes, but I'm also going to say there's people who get to us who are really sick, and while I wish that I could say you're going to get a transplant, when they start getting really sick, I'm like, we need to get to a big center. Duke did, I think, 147 last year, lung transplants.
Right.
They're it's huge, but that's the deal. You want to be, you have to be where you're going to be socially supported, and then there's the donor offers. So sometimes it's good to be in multiple centers, so if there is a donor that happens to match your blood type and your height and the type of lung you need. It gets really complicated. That's a whole bunch, but I'll tell you more about that later. Yeah.
You mentioned a while ago stem cell. Do you know of anybody currently doing stem cell work on pulmonary fibrosis?
I don't think in pulmonary fibrosis, actually, sorry, I forgot your name, but we were just...
Peter.
Peter.
Well, they're looking at it, but there's nothing concrete right now, and there's just a few doctors in Greece and in Mexico, somewhere in a abandoned village or so, that are doing that, and most of it is more like a...
model.
Well...
I got a phone call. I called and a friend of mine hadn't seen in 15 years. I told him about my own problems, and he said, don't give up hope. My next door neighbor little older than us, he's 70. He went to his doctor and was diagnosed with lung cancer, terminal. They sent him home. And they turned around and called him and asked if he'd like to be part of an experimental program. He said, sure, I'll try anything. They was in him. They take his stem cells out, they do something with them, they put them back in.
Yeah.
He said, Bob, we get up in the morning, if our feet and ankles aren't hurting, we go jogging. And I said, wait a minute, well, man, you go from a lung cancer patient to a morning jogger.
Yeah.
That sounds like a miracle. He said, that's what it sounds like.
There's a lot of really cool research going on right now, and MCV is doing some pulmonary fibrosis trials. I know we are at UVA, and I've had a few patients who've been in those trials, and it's been a good experience for them. Not everybody's a candidate.
I have a quick question, I think, but I'm not sure. Someone like Steve Jobs lives out in California. He gets on the list for Memphis, Tennessee, and gets a pancreas like that.
Because he has a private jet. He can be anywhere.
So can you, if you get a private jet, and it's not that much comparatively speaking, how do people in this room know where to register to get something fast?
Well, no, there's no getting something fast. Every place you go, you have to go through an evaluation, and you have to get through their selection committee.
Okay, but you know what I'm saying.
So
there was some like intelligence or something for all this to get put in place real quick.
And you're exactly right. First of all, with a lot more kidneys, it gets really complicated with kidneys and livers and sharing and wait lists. Lungs, it's hard to match with the lung, but it's a little bit more straightforward, I think. But you're exactly right. As long as you can get to the center in the time required for them to begin your transplant. So at UVA, you have to be able to get there between 3.5 to 4 hours. So Angel Flight is one of the people that helps us, and they're wonderful. They'll find pilots, take care of people from Southwest Virginia.
You get a helicopter. I mean, that's
Yeah,
no problem.
insurance, you have to check your insurance, but you have to safely get where you're going for your transplant. Safely.
Can I ask you a question?
Yeah.
Getting back to the weight, you have easily flop, right? When you lost your 60 pounds, did you have help with the doctors, or you did it all on your own?
Well, I did it all on my own because I had the motivation of, if I didn't lose the weight, I was not going to get a transplant.
How long did it take?
About a year.
About a year. All right, thank you.
Yeah, a lot of pulmonary rehab programs have a nutrition program attached to it.
And you know the thing is, those nutritionists, they're going to irritate the dicks out of you because you go in there,
you're
like
a
I
coordinator.
was fat, and the nutritionist comes in, and she's fat.
All of them.
One of them is that big. And they've never been like,
Never been big. That's right, that's what they get to, the aggravate.
Well, my dad would say he used to weigh 188 pounds, so I feel you. So you can lose it. You gotta watch it, Weight Watchers.
I'm just making a statement that when you vote in November, the Republicans are holding up stem cell research. George Bush tried to push it back 20 years. That's my comment on that.
Well, I don't know about, I want you to educate yourself on all kinds of things, but I want you to educate yourself on good nutrition, on the science that's out there, and on the research that's being done. There's some really very cool research going on, and that's part of it.
Just one thing, when I was trying to, I won't say Heidi's list, but it wasn't. But when she would call me, I was going through the evaluation, and I got 1 pound of my being in my cup. She called and told me I'm still obese.
1 pound.
1 pound?
Well,
It's not me. It's horrible. It's really hard. And they'll come in. And Mr. Smith tried to take his clothes off every time. I was like, don't wear your Speedo up here. I'll have to do with the Speedo.
going down the hallway,